1, 2, 3, action. All right, good. Thank you. Thank you, guys. Happy Thursday, as always. Today we're going to talk about generalization, but before that, we'll just do a quick review on some of the things we covered throughout the previous weeks, primarily discrimination, training, and prompting. So just as a quick refresher, discrimination is training is when we're teaching the client or the learner when things are different. So that this thing is different here, and that you only get a reinforcement when this is present and not when it's absent. So that's discrimination training in a nutshell. And then we've gone through all the numerous types of prompting. We can talk about the physical, hand over hand, and we can start fading that out to partial, to graduate guidance, all the various types of verbal prompts, gestural prompts, modeling. We went through all those and some of the fading procedures that are included, either going from the most intrusive prompts to the least intrusive, or the least intrusive to the most intrusive. We covered all that. So let's see if we can answer some of these questions. And apologies for whatever reason I couldn't make the triangle for the S delta, so I ended up just using the emoji here. So the first question, funny enough, on discrimination training, what do we call the stimulus that signals reinforcement is available for specific behavior? Is it A, the prompt, B, the reinforcer, C, the S delta, or D, the SD? I'm hearing D. D. C? Let's see. It is D. Yes, good, great. Yeah, D. That's right. The discriminated stimulus. What the S delta is, it's pretty much the opposite. It shows you that reinforcement is not available. So think of the green stoplight, or the green stoplight going off, telling you you can get reinforcement by moving your vehicle forward by driving. Whereas with the red light, it tells you that reinforcement is not available. You cannot drive. Otherwise, things wouldn't end so great for you. Great. Okay, so this is on the fading procedures. A client is learning to use a microwave to heat their lunch. You initially provide hand-over-hand guidance for every step. Over several days, you move to just touching their elbow and then just pointing. This is an example of A, least to most prompting, B, most to least prompting, or C, total task chaining. B. So I'm hearing B. Let's take a look. Yes.
Total task chaining.
It is most to least.
Most to least prompt.
Yes, because we're starting with something that is most intrusive, that being the physical prompt, the full physical, and then that gets faded to a partial, then to, I believe, the pointing, which is just a gesture. At that point, it is the least intrusive prompt. Total task chaining involves prompting throughout the process. Okay. You are teaching a client to use a vending machine. You stand behind them and physically guide their hand towards the dollar bill. What type of prompt is this?
Physical?
Yes, physical, yes. That was quick, nice. Yeah, physical prompt. A gesture would be pointing, modeling would be displaying how to put the dollar in the machine, and then a visual would probably be a picture of somebody putting it into the machine. You are teaching a client to differentiate between men's and women's restroom signs. You provide a snack when they point to the correct sign for them, and no snack when they point to the incorrect one. This is A, maintenance, B, discrimination training, C, generalization training, or D, backwards chaining.
B.
C.
I'm hearing C. I'm hearing B. Okay, let's see. It is B. Yes.
Why?
Discrimination is when we're trying to tell them apart. They're different. let's say we have a male client, we're teaching him that only when he goes to the male restroom is that the appropriate SD, and it won't be appropriate if he goes into the women's restroom. Because with generalization, we would start teaching them that these things are they're all the same, they're very similar, so you can do these things in multiple contexts, which in this case may not be what we want. So that is why it's discrimination. Yes. Again, discrimination, it's just a way to say something is different, to distinguish. Okay, a client is learning to sweep the floor. To fade your prompts, you decide to wait 5 seconds after the client finishes one section to see if they move to the next section on their own before you point to it. This is
Shadowing.
I'm hearing A. That seems to be the most prominent answer. Okay. Yes, it is time delay. Time delay is the type of prompting where instead of putting in the prompt, you wait a certain amount of time to give the client or the learner, an individual, an opportunity to respond before giving the prompt. Shadowing is when you're barely hovering over it. It's almost like a partial prompt, but you're not making contact. And then stimulus fading is something else. And then we have already discussed most of these prompting. Great. This should be the last one of the review questions. To fade a visual prompt, you have a picture of a wash hand sign that is very bright. Over the next 2 weeks, you replace it with a lighter and lighter copies until it is just a faint outline of the wash hand sign. What is this? So is this most to least, response fading, stimulus fading, or maintenance probe?
We don't have it in the packet.
You don't have it in the packet. I always do something. It's not a Thursday without at least one mistake on my behalf. Okay, well, are your guys in the back able to see the question? It's fine. All right, then. We can do this just collaboratively then. So A is least to most, B is response fading,
That is stimulus.
C is stimulus fading, and D is maintenance probe.
Stimulus?
So it looks like Willie's saying C, stimulus fading. Anybody have anything different? Anybody in accordance?
Let's come back to paint.
Okay, I'm hearing C. We're getting some agreement. Let's take a look. Yes, it is C, stimulus fading. Yeah, same thing with the example we had last week with the stop sign, how we made it very obvious that it was the right answer with it being bigger. And then as we begin to fade the stimulus, we make it smaller and smaller, less obvious. So again, sorry I didn't include that one. That was a good question. But at any rate, we press onwards. Okay, any questions before we move on to generalization? Okay, great. Well, besides my minor hiccup, it sounds like everything's going well. Okay, so when it comes to generalization, it's probably one of the most important components of any effective goals or treatment plans. I'm going to play a video first before we get more into these slides about why generalization is such an important topic to consider. But ultimately, we can think of it practically. We don't want to waste our time. We don't want to waste the client's time by teaching them, let's say, these skills that they probably won't utilize outside of a very specific context, when we could have been doing something much more productive otherwise. And this video by one of my favorite behavior analysts, his name is Jonathan Tarbox, I think does a really great job of explaining this. Let's just take a look at the way he would define generalization.
for people who don't watch all the time, if they're wondering about generalization, can you explain to us what you mean when you're talking about that and why it's so important?
Sure, yeah. Generalization is really critical. And what it means is, sort of the lay definition is, once you learn a concept, it's the ability to apply that concept whenever and wherever you need to apply it in your daily life. Okay? And it's something that happens so automatically in the typically developing population that we don't even really realize that it matters. So, for example, if you learn how to add numbers in a classroom at your desk, now when you go to the grocery store, can you add numbers? Sure, right? Like you when you're a kid, pretty much, right? More or less. Well, or if you learn your ABCs, with your tutor or your mom or whatever, do you still know your ABCs when you're talking to a different person in a different place? Sure, obviously, right? Well, with autism spectrum disorders, and especially early on with younger kids, that doesn't happen automatically, right? And that learning something in one environment and being able to do it in another is generalization. And it does not happen automatically in a lot of folks with autism spectrum disorders, and so you need to program for it on purpose. In other words, you need to take steps to ensure that your child is able to apply what they learned across all aspects of his or her life. And the key way to do that is practicing, imagine that, practicing what he or she learned across all aspects of their lives. And so if your child learns a piece of language during their tutoring or ABA therapy sessions, they need to practice the use of that same exact word when those therapists are not present. They need to practice with you, they need to practice with dad, grandma, grandpa, babysitter, nanny, teacher, peers, at the park, at the mall, in your living room, right? In your front yard, backyard. That's the way that you ensure that your child can actually use the concepts that they learn across their everyday life.
And that's how we set them up for success.
Absolutely. And honestly, without that, I mean, this is a one red flag of a bad quality ABA program, not just ABA, but any bad quality autism treatment program, is a lack of generalization. And so what you'll find is the therapist will tell you, oh yeah, he learned, he mastered 100 different skills, in the last month, and then you go and see can the kid actually do it, and he can't do it with you.
Right.
He can only do it with the particular therapist that taught him, and only when they're sitting at the table.
Right.
Which, in other words, means he didn't learn anything at all.
Right. Really important that we make sure that our kids can do these skills in all different kinds of settings with all kinds of people.
Right. Otherwise, they won't be able to actually use the skills when they need to in their life. What's the point? We're wasting the kid's time.
Yeah, no, the examples they use pertain to children, so young clients, but I think the principles still stand true. And I'm sure for some of you who have experience at the care homes can also note that there could be differences between the way clients interact or act or behave in the care home versus here. I'm sure a couple of prime examples kind of come up, and we can kind of think of it as them having this different skill set that they have access to, one that has not gone through proper generalization. Oh, let me just go back to that. So that is the ultimate goal of any good behavioral treatment, is to ensure that the client can have these skills and different behaviors in multiple contexts with multiple individuals. Otherwise, if we don't program for that, we could get in situations like this one where there are clients that are so dependent on certain circumstances occurring where unless the stars align, they won't be able to do what it is they need to do. So this is a good example of prompt dependency and how it's a lack of generalization.
Hi, Valerie. Welcome to school. How do you have your book bag? Oh, Valerie, you come into your book bag. Oh, you're almost there. It's right there.
So you see, she needs these constant
Right here.
verbal
Right
and
here on the wall.
gestural prompts.
Okay. All right.
She could probably do this just fine at home, but here at the school, those skills, those behaviors haven't generalized.
You gotta hold it right here.
Teaching what to
What do we
do.
do after our book bag? You could go sit at the table and read the book.
Yeah, you see how it's kind of like too much prompting, Willie, where
Yes.
maybe at home she can do all this just fine.
Right there, sit down.
And there's
Right
to
there, the yellow chair.
familiarize.
You just sit right there.
Okay.
There you go. Nice job.
Yeah, that took a while, didn't it? Something that probably could have taken her 5 seconds to do at home took constant prompting at the school setting. So that's just an example of what
Stimuli.
lack of generalization can lead to. So yeah, when we talk about generalization more broadly, we talk about it being applied across people, places, and things. Maintenance, so the skill retains over time, and then independence, which is the most evident where they're able to do it without our assistance. Yeah, so let's get to the specific types of generalizations. So when we talk about stimulus generalization, this is when the same behavior can occur across multiple contexts, with multiple people, with multiple places, and with different materials.
People, stimuli.
Mhm.
Settings and materials.
Yes.
People.
Yes. So for me, one of the most important skills for a client to have would be to be able to make independent requests. It is not very useful if the client can, let's say, only make requests for their food or their favorite things when they're here in the program, and then they can't do it at home. Then I also like this example too, coming back to the whole bathroom sign fiasco. Yeah, what good does it do the client if they can identify where the bathroom is or how to find the bathroom here at the program, but they can't do it when they're at the grocery store, or they can't do it when they're out in the community. So we want them to be able to do the same thing, but in a different place or a different context. That is the ultimate goal of developing stimulus generalization. And I have a humorous example of what stimulus generalization may look like here.
These are tarantulas. These are very dangerous. They can bite you. Are they gonna eat me?
Yeah, just a little humorous example of that. You see, she looked at the pictures of the tarantula online, and then her friend told her that they're scary, they'll probably bite her, and then she saw this stimulus and acted accordingly as though it was a real spider. So we can say that that response has been generalized. Yeah, just like I said, just a humorous example of it. Okay. Any other thoughts or questions on stimulus generalization? Or move on? Okay. I think this is. I don't think I have anything in the notes for this, but it's just a nice refresher where we can kind of think of generalization discrimination being on a spectrum, where for generalization we want the behaviors to occur more often in different contexts, in different places, with different people. Whereas for discrimination, the more you want them to discriminate, the less and less context that you want the behavior to occur in. And when we also think of it this way too, we can kind of look at the two extremes. One would be overgeneralization, where the individual is treating things too similarly. So, for example, the whole bathroom sign thing. If they learn that, oh, if I just follow any bathroom sign, I can go there. It doesn't really work out if, let's say, they're going to the opposite sex's restroom. But then you can also have the problem of what is referred to as faulty discrimination. And this is kind of in the same vein as the prompt dependency, where the individual is only responding when very particular circumstances are happening. And this is one that I think could be a little bit of a slippery slope when we don't try to plan for generalization. And to give you guys an example of something that I had to encounter very recently, just a few months ago, this involved, this was the client who called me cockroach. You guys remember from last week? Yeah, same guy. He is late 30s, Down syndrome, moderate ID, just to give you an idea of who we're talking about. And he has echolalia. So whenever you say something to him, chances are he's just going to repeat what you said to him right back. And we can kind of use this echolalia to teach him to make requests independently. So that's what we were doing with him. I was helping the care home staff try to probe out some of the things that he most commonly requests. And recently too, I went to his annual and I found out that at his program, he likes looking at coloring pages. There is a website called Monday Mandala where it's just pages upon pages of coloring pages that he just likes to look at and he just likes to sift through. So I'm there at his home, and he most of the time during the evening he's just hanging out with the care home staff. They're in the living room, and then when they have to get up and do something, he's just kind of sitting there. So I'm thinking, okay, you could probably use this opportunity to get him to ask to watch something on the TV since it's right there. And I'm just thinking, okay, well, he likes coloring pages. Maybe he'll enjoy watching somebody do watercoloring or water painting on the TV. And when I showed it to him, it turns out that he really liked it. So much so that I even got him to start requesting for it. Although with him, given his limited vocal ability, he would just say coloring. So okay, coloring. That would be his request. So whenever he do that, I would play for him the coloring. And we did this 1 week, and then the following week I came back to the home, and I think I was with another client, and he comes up to me, just stands right in front of me, and I'm looking at him, I'm attending, I'm just waiting to see what he would do, and then he points to the living room, to where the TV is, and he says, "That." So at this point, I have a feeling I know what he wants. Uh, but I'm gonna put in a. I was gonna see if I could get away with putting a time delay, to see if he would say coloring. And sure enough, 5 seconds later, he did. After he says that, he looks at me, coloring. Sure, no problem, my friend. Great job. You got it. So then I rushed all to the TV. I put it on for him, and he was happy. We're off to the races. Next week comes along, similar thing happens. He comes up to me, he asks for it, and I put it on. No problem. Hey, if that's what you want to watch, no problem. But then the following week came, and he did it again. And I'm starting to think, wait, is he only doing this with me? Oh no. So then I asked the care home staff, oh hey, he really likes watching coloring videos while he's here at home. Is he asking you guys if he could put it on for him? And they said no, he never asked us. It's like, okay, man, we have a case of faulty discrimination here, because you can kind of think of it as him associating when I'm there, I'm the SD for coloring videos. If I'm not there, he can't watch it. But if I'm there, he could ask for it, and I can put it on. Which, it's good that he can demonstrate he can make that request, but I'm only there once a week, which, if this is something that he enjoys doing and watching, not exactly ideal for him if I'm the only one who's able to give to him, when pretty much almost everybody else in the home can. So once I realized this, he came up to me, he tried asking, and I just told him, go ask Angie, go ask the staff. And eventually, yeah, he got to the point where he was asking them, and then even asking another client to put it on for him. I had another client put it on, just so then he can associate that I no longer can provide it. I told him I forgot how to do it. I don't know how to put on coloring anymore, but so and so can. And that's kind of how we overcame that faulty discrimination. But yeah, that was my mistake. I didn't count on to generalize. So that's an example of my need to address it. Okay, moving on to response generalization. This is where it's a similar situation. It's the same one, but the behavior itself looks different, but it accomplishes the same thing. So I think the best example for this would be a greeting. I mean, there are just so many different ways we can greet somebody. We can say hello, and depending on the day, we can say good morning, how are you, ¿Cómo está acá? Yeah, for instance, all of these things look and sound different, but they're pretty much accomplishing the same thing. And that is what response generalization is all about. And this is important for a few reasons. One, it teaches a bit of flexibility where, you don't have to respond the same way every single time, all the time. So then it makes it much more natural and organic. And then also it just gives them much more options for how they can respond. So that is what response generalization is. So with stimulus generalization, different context, same behavior. Response generalization, same context, but different behavior. But the different behavior pretty much is the exact same, serves the same purpose. You can think of it as asking somebody how they're doing, accomplishes the exact same thing of just simply greeting them.
Untrained responses.
Mm-hmm.
Use untrained responses, but functionality of prevalent responses.
Okay. Everybody with me so far? Awesome. Okay. Now we're talking about response maintenance. And this is when behavior maintained to persist throughout the individual's life. This is for the long term. And we're going to talk about the acquisition and generalization phases shortly. But this is just something that may come up where just because a goal isn't on the ISP or the BIP anymore, it doesn't mean we all of a sudden just stop reinforcing it. If anything, it means that the client has mastered that goal. So now we can focus on building up other skills and goals. But that one goal that has been mastered now can be persisted. That's something that the client is now able to do alone, independently, that no longer needs formal intervention. Yeah, and there are so many things that kind of can rock the boat when it comes to maintenance. So, for instance, a client going on a very extensive vacation, chances are, unless the people they're going with are going to maintain some of their treatment plan, they're probably going to lose that skill. That is response maintenance. So again, stimulus generalization, same context, different behavior. That would be for response generalization. And then for stimulus generalization, we have the same behavior but a different context. Response maintenance, the behavior lasts for the long term. In some response maintenance strategies to ensure that they keep it and they don't lose it. For one, we touched on this one when we talked about schedules of reinforcement, but it's going from a continuous schedule of reinforcement to an intermittent one. Continuous, it's for when we're building up the skill. We're always reinforcing. Every time the client asks for something, let's say if they're working on making a request, they get it. But then when it comes to intermittent schedule, think of it as it being a lottery schedule where sometimes they get reinforcement, sometimes they don't. But that persistence and that kind of schedule allows the behavior to persist over time. Natural reinforcers, I think, should be baked into the intervention. So, for instance, if somebody does something that is praiseworthy and noteworthy, then we definitely want to pair praise with them giving the correct response. But over time, just the natural consequences of the skill should lead to reinforcement. So, for instance, if we're giving an instruction to open the door, instead of giving candy or giving praise, the natural consequence of that is reinforcing them getting to go outside, for instance. And then programming for common stimuli, so making things as similar across multiple settings. So I think the example I put here is using the same AAC device or the same speech device here at the program that they use at home. And fortunately, most CTEC consults allow for that, with clients having their own individual devices. Okay, then moving on. Yes, training loosely. I love training loosely. Just as we're trying to get the clients to be a little bit more flexible, we want to be somewhat flexible with our instruction. So this is this idea of being consistent, but not too perfect with the delivery of, let's say, a particular SD. Because this can also help avoid the over selectivity or the faulty discrimination, where, let's say, a client is taught to follow an instruction, but only when you give them in a particular volume, a particular form of speech, and said a particular way. And believe me, I've seen this happen. We talked to Jonathan Tarbox talked about how a ABA therapist could teach a client 100 different skills and them only be able to do it with them. Well, sometimes the extreme case could be it doesn't even work with the one individual because they have to do it a particular way. So there are many ways we can consider teaching loosely, but I think the two most important ones would be changing the tone of voice and then varying the instruction. I think that is the biggest one. Putting on your coat versus go dressed to go outside, or put on your coat so we can go outside. These various ways we can just slightly change the SD. If anything, we ourselves are practicing response generalization by doing so. And again, it's all for the sake of still being consistent, but allowing for some flexibility to occur. Plus, when we talked about generalization, we mentioned how variety is good, and variety is good in this context as well. Okay, and so here is good. So that is generalization in a nutshell. Any questions on C8? No? Okay. This one's pretty short and simple, pretty cut and dry. This is just about acquisition and maintenance procedures. So we can kind of think of there being two main phases when it comes to providing intervention. There's the acquisition phase, that's where we're building up the skill, and then there's the maintenance phase where we're maintaining it. And the skills that we particularly work on when it comes to acquisition are found in the ISP, the BIP, the behavior support plan, and those I think we try to do a good enough job on explaining the procedures and including all of the necessary components to ensure that the acquisition skill can go off without a hitch for the particular goals that we're working on. And then for some of the more complex skills, we incorporate error risk learning, and with it, along with anything where we involve continuous reinforcement, we want reinforcement to be delivered quick, efficiently, and at a high enough magnitude. That's interesting. Now we're kind of reaching the point where we're touching on things that we previously discussed.
Imitate.
I think that's it. All I have for the acquisition phase. Are you still scribbling? Yeah, acquisition phase is something that we primarily focus on, especially with the newer clients that come in for evidential reasons. Okay, maintenance phase. Again, just because the goal or the skill is no longer in the ISP doesn't mean we just all of a sudden forget about it. I'm sure there have been, especially for the clients who've been here longer, Vaughn, I'm sure you can attest that their ISPs have gone through numerous renditions, and some of those skills that were included there previously we're still probably still using, interacting, but just not tracking it to the same degree as the acquisitions goals. And yeah, something that I'd like to do, especially with clients that I don't see too often at the care homes, is to probe. So kind of give them the SD to the previous goal that we've included in their BIP. And if they got it, then great. If not, then, well, let's maybe spend a little bit of time on this before moving on to what we have in their current plan. And then, yeah, same thing as teaching for generalization. We want to include as much natural reinforcement as possible. So the example of zipping, once you learn how to zip up your jacket, well, now you can go outside when it's cold. No problem there. Instead of getting a token or relying so much on praise. That is what we have for maintenance. And then we go from continuous reinforcement down to intermediate. So this is just us thinning the schedule. So we're going to vary the amount of reinforcement we give in a manner that is unpredictable to the client. Yeah, and as I mentioned earlier, if the client fails some of the probes that we do for some of their previous goals, then yeah, maybe we can just take a quick step back, build that skill back up, or just do a little bit of touch up before going into reteaching, or teaching the new skills rather. There is one video I would love to show you guys, and we can probably end off with this. Yeah. The context of this video is he's talking about fluency, which is something we are going to touch on when we talk about more data collection. But I think this also relates to maintenance and the importance of building up these skills, especially the most crucial ones like making requests, following instructions, waiting. These are things that are so important in the client's lives, something that we kind of can take for granted. And if we're able to just set them up for that to be in their long-term plan, then that is probably the most ideal circumstance. And this individual, his name is Dr. Patrick McGreevy. He is one of my idols, one of my favorite behavior analysts, and is a huge influence into what it is I'm trying to do. And I really like this little segment that he did.
Some people are coming up. I said, when?
Yeah, this is just him talking about a story of his and then kind of relating it to the importance of maintaining these skills, just for some context.
To service for a friend of mine, Dr. Maria Ruiz, who passed away several years ago at a very young age, and Tom Freeman. Anybody know Tom Freeman? Behavior analyst? Yeah. All right. Tom Freeman is sitting in the pew next to me. He knows a little bit about my religious history. I was a Catholic seminarian when I was in a different lifetime. And he said, I'll bet you, because they announced that they were going to do, because the parents requested a Latin Catholic Mass in Latin. They were from Cuba, very traditional Catholic country. So Tom said to me, I'll bet you know part of this. Yeah, if you could find people that would take $10 bets, I'd recommend you take all the $10 bets you can get, because I'll win them all for you. I seriously will. I'll win them all for you. And I said, when the priest comes out, he's going to say, introibo ad, and I'll say it slow so you know that I'm not saying it fast to cover up my mistakes. Introibo ad altare Dei. When you can do it that slow, it's fluent. The altar boy will say, ad Deum qui laetificat juventutem meam, syllable for syllable. Last time I had to do that was 45 years ago. Only way that goes away is brain damage. Otherwise, that's there forever. They're there forever. Just think about it yourself. Think about things you learned. You ready? I before E. Could you forget that? Not if you wanted to forget that. If you said, I am on a path of forgetting that. You couldn't do it. You're stuck with that for the rest of your life. How about the one that's a little less common? When two vowels go walking, first one does the talking. There you are. That'll last you the rest of your life. That's the kind of teaching we want to put into place so that it's fluent. It happens correctly and without hesitation, no prior practice. Boom. So when the first time I walk in and I sit down with you and I'm going to ask you to come here, I'm going to say, Frank, he and I met before, so I remember his name right away. I said, Frank, come here. I want Frank on the way before I finish, come here. I want at the very end, he's up and moving and he's getting to me. There's no hesitation in responding to me and no hesitation in completing it. And those are the skills that will come as close to lasting forever as we know how to do. Serious. Those will come as close to forever as we know how to do. So now, we're not going to...
Yeah, there you go. I think it was just a great example of what maintenance looks like for the long run. Again, he's talking about fluency, but there's a lot of overlap in that, whereas there's that zero hesitancy. And like you said, the second he started saying, oh, Frank, come here, he was already on his way moving. And especially when we're talking about safety and other concerns like that, those are the kind of things we want to be able to address. Okay, we can probably talk about the other questions, reading questions next time. But yeah, thank you guys. I won't keep you any longer.